Hi, my name is Kerry Teggart. I'm a sophomore speech pathology student at Kent State University, and today I'm going to be discussing fluency disorders. A fluency disorder is a speech disorder in which the forward flow of speech is disrupted by involuntary repetitions or prolongations, or by an individual's inability to start a word. This is otherwise known as stuttering or stammering. And when we learned about disfluency in class, it was just something that really fascinated me, so I decided to devote my video project on the subject as a way to learn more about it myself and hopefully educate others about it. Stuttering is one of the most prevalent communication disorders. It's estimated that 3 million Americans and 68 million people worldwide suffer from stuttering. Stuttering is most frequently seen in children ages 2 to 6 who are first developing their language skills, and actually about 5% of children do develop stuttering at some point of their childhood. However, 3/4 of them are able to recover from the stuttering within 6 months. An interesting fact is that boys are almost 4 times more likely to suffer from stuttering than girls are. And the following chart shows the percent of children reported to have a stuttering problem by a healthcare professional. The purple represents males and the yellow represents females. And this data was taken back in 2003, but there hasn't been any dramatic changes in the data. So this will give you a visual representation of how many more males have a reported problem than females, and how you can see how significant that is, and also how as age increases, the rate of fluency disorders decreases pretty dramatically. The cause of stuttering is still unknown. However, there are some factors that people believe may contribute to the onset of stuttering. One of them is genetics. About 60% of people with the fluency disorder have a family member with the same fluency disorder. Child development and family dynamics may also play a role in this. And recent neurological research suggests that people with a stutter process speech and language slightly different than people who don't. So neurophysiology can also play a role. And although the cause is unknown for the most part, those factors are believed to be contributed to the onset of stuttering. There are 3 different types of stuttering, and those are repetition, prolongations, and blocks. While everyone has some natural disfluency, a person who stutters has a significant amount. For each example, I'm going to show that specific stuttering behavior and use the same 3 sentences, so you'll get an example of each different type of stuttering.
I have 2 more weeks of school left and I'm excited for summer.
Repetition is when a certain syllable, word, or sound is repeated several times to disrupt the forward flow of speech. This is among the most common in people who stutter. In the previous example, the speaker was demonstrating repetition stuttering in the T in to and also the S in summer.
I have 2 more weeks of school left and I'm really excited for summer.
Prolongations occur when the continuous production of airflow is heard with no articulation. This can last for up to a few seconds, and to a listener, it may sound like the person is stretching out a sound for longer than they should. In the previous example, the speaker was using a prolongation in the S sound for summer.
I have 2 more weeks of school left and I'm really excited for summer.
Blocks or hesitations are associated with more severe stuttering. This is the total stopping of voicing and airflow. These people may appear very tense and out of breath when they are trying to speak. The person is usually able to get their word out with effort, but they do often use interjections such as like or in order to intentionally delay the word they're stuck on. In this example, the speaker has appeared to stop all airflow needed to produce her next word, and she is eventually able to finish the sentence with the word summer. Identifying stuttering in one's speech may seem like something that anyone could do, but there are many characteristics of stuttering that are not as easy to detect to normal listeners. Diagnosing a fluency disorder does require the evaluation of a speech-language pathologist, and during this evaluation, the SLP will note the number of times an individual will stutter in a particular situation, how they react to their stutter, and outside factors that may affect their stuttering. Their speech rate and language skills are also diagnosed, and at that time it is decided whether they have a fluency disorder and to what rate it affects their daily life. For younger children, it is harder to distinguish if the stuttering will last. Some risk factors may include stuttering in family members, or if the stutter still exists after 6 months, or previous speech-language problems the child may have. As far as treatments go for stuttering, there is no cure for the disorder. However, it can be treated by a speech-language pathologist. Most treatments are considered behavioral in that they work with the patient to develop skills in improving their oral communication. Speech-language pathologists may work also to control the rate of speech, control tenseness, and monitor breathing. They also may work with their patient on psychological effects their stuttering may have on them, such as a fear of public speaking or talking on the phone. The main treatment goals of stuttering are just to help the individual speak more fluently, communicate more effectively, and participate more fully in their daily life activities. So as you can see, treatment, and especially early intervention in children, are very important with people who stutter. Although any communication disorder can definitely be frustrating, working with a speech-language pathologist can improve a stutterer's communication and help them get along better in daily life. Thank you for watching my video, and I hope you were able to learn a little bit more about fluency disorders today.